The headlines couldn't be clearer. Healthcare is on everybody's mind and is perhaps the biggest challenge facing the current administration and business leaders. While the debate over healthcare continues, the cost for employers to provide coverage is soaring, cutting into profits and productivity and begging the question, is there a way to reduce costs without compromising employee health?
Healthcare cost containment has gotten to be such a competitive disadvantage for America and for the United States industry in general. And so what employers had to do on one level is start to shift cost to employees. They've had to reduce benefits for employees, which increasingly makes this third solution the true win-win solution. And that's employee health management programs that really increasingly are being blended with a lot of strategies. We call it total health management. It's looking at the whole strategy, disability management, employee assistance programs, disease management, wellness programs, all with an intent to come up with a solution that employees love, that they're engaged in, but also not just reduces healthcare costs, but it increases employee productivity, increases employee retention, increases employee satisfaction. It's really a win-win for everybody.
Total health management strategies are designed to give individuals the knowledge, skills, and motivation they need to embrace healthier lifestyles, use the healthcare system wisely, and avoid or manage potentially costly health conditions. By offering any number or combination of programs, employers can enhance their employees' quality of life while addressing some of the company's most pressing issues.
There are probably two major challenges that employers face today. One is rising healthcare costs, and the other is engaging populations to change their behavior. Both are very challenging and complicated. Employers are using total health management strategies to attack both of those issues.
Employers have very high expectations in their health management programs. They have to be very efficient, they have to be very high quality, and the different vendor partners that might be coming together to deliver those services for that employer have to play very well in the sandbox together. And ultimately, the programs have to engage people, the execution of the programs have to be flawless for the employer to really reap the benefits of the investment in their programs.
Total health management programs are completely customized to the health status and needs of each company and each employee. Business owners can tailor their programs and invest according to their ability or build on a program over time.
Employers really need to understand what the best practices are that separate a positive program result from one that might not be as positive. The best practices revolve around things like the program strategy, the program components, how they're managed within the organization. It needs to be delivered in a way that has culture of support, and you also have leadership support, environment at work, and then ultimately a measurement strategy that allows you to really see how the program's working, process improvement, and the outcomes to fuel the future of your program.
Health management research has linked excess healthcare costs to health risks. Meanwhile, positive employer outcomes continue to demonstrate that investments in employee health save money.
Companies can start to see significant financial results probably in years 2 and 3. So it's important when they go into these strategies to keep that in mind, to document what they're measuring along the way. When implementing a wellness program, employers face a couple of challenges. One is engaging their population. Engagement can happen through incentives, financial or otherwise, through good communications to explain to employees why or why not to do these things. And it can also involve, of course, getting leadership support as well as peers. The other piece that they have to remember is the long-term investment, that this is not a short-term quick fix, but that it will take not only financial resources, but companies' investment and leadership.
Affinia Group, an automotive replacement parts manufacturer based in Ann Arbor, Michigan, launched its health management program in 2003 after realizing year after year increases in healthcare costs.
The most important trend that we've noticed is the improvement in the health status of our people, and a related trend is the reduction in the growth rate of our healthcare costs. In terms of improvement of the health status of our people, in 2003, as hard as this is to imagine, we had 33% of our people at high health risk. That number was reduced from 33% all the way down to 10% in 2008. That's really a remarkable improvement and a credit to our people. The year of 2002, a single year increase of 36% in our healthcare costs. The year prior, a single year increase of 28%. These were just unsustainable. During the 6-year period from 2003 through and including 2009, we have had a compound annual growth rate in our healthcare costs of less than 2%.
Mercer conducted research on programs that were in this wellness area to determine whether they actually worked. And when we compare Affinia's results to those, we see that Affinia's were very, very strong. We see on average a 2-to-1 return on investment. We see roughly a 2 to 4% impact on total health care costs. And Affinia's been able to achieve or exceed those.
We felt that actually creating a paper document, which we called a covenant, raised our relationship with our people to a higher level, almost a moral and ethical level. So we created a covenant which we asked our people and their covered spouses to sign. And in signing the covenant, they agreed in writing to accept responsibility for maintaining and promoting their own health and well-being.
Health management companies have shown that a best practice program can have a positive financial impact on a company. But the success of the program hinges on the employer's ability to engage employees for long-term change.
Improving the health of employee populations begins with a foundation of engaged leadership. By that I mean senior managers who truly support and believe in the goals of the program and role model the program in their daily behaviors. Second are accountable management across all levels of management so that you have aligned support for the goals of the program. With that foundation in place, there are what I call 3 pillars of engagement. The first and I think most important of those is a healthy, supportive worksite culture. Second, clear and credible communications to employees about the goals of the program. Finally, appropriate incentives are important in the success of the program. In terms of incentives, though, we found that incentives don't tend to work without a supportive culture. Without that support, what you tend to get is a pay-to-play attitude about health. And that can backfire because employees will only engage in healthy activities if the incentive is there for them.
Incentives are only one tool in the toolbox, and they play a very specific role in an overall program.
The right incentive strategy can be really challenging. So for behavior change, like the health coaching programs that we offer, modest incentives tend to work best. In terms of the kinds of strategies that we're seeing employers use that are working most effectively, there's a trend towards integrating the incentive strategy into the health plan. The second trend we're seeing is a tiered approach where people can earn partial incentives through a variety of activities, or what I'd say it would be a menu of program offerings. And the other trend we're seeing is a trend towards incentives tied to both outcomes and activities. And the idea there is for people already engaging in healthy behaviors, they can get credit for that.
Probably the most exciting thing that's happening in health programs broadly for the employers is we really are changing the world. And what I mean by that is that we know that changing just individuals and helping them make health habit changes is pretty hard work. But it's harder work if we don't change the world around them, if we don't change the environment that they're doing their work in and that they're living in.
StayWell Health Management. Changing behavior, changing lives. To inquire about total health management programs, email us at marketing@staywell.com or call the number on your screen.